Today we're going to be going over the pros and the cons and everything in between when it comes to Medicare Supplement Plan Gs. But before we do that, it's important to know fundamentally how Medicare Supplement Plan Gs are going to cover you, whether you're turning 65, retiring soon, or already on Medicare. So let's start with the basics. How does Medicare Supplement Plan G work in 2025? When you have original Medicare, which is Medicare Part A and Medicare Part B, there are going to be certain exposures or responsibilities that you are going to be responsible for if you don't have a Medicare Supplement Plan G. Some of those responsibilities are the Part A deductible, the Part B deductible, the Part B 20% coinsurance, and even the Part B excess charges, which if you don't know what the Part B excess charges are, basically Medicare releases all these different amounts that doctors and surgeons and hospitals are allowed to charge for certain services. Well, if your provider doesn't take that as full payment, they can actually charge up to 15% more, and you're responsible for that. Now, it's also important to mention that there is no out-of-pocket maximum when it comes to Medicare Part A and Part B. You could be out $1 million and you pay $200,000 worth of those bills. That's where Medigap plans or Medicare Supplement plans like Plan G come in, and they fill those gaps in original Medicare Part A and Part B. So now that you know that, let's take a look at some of the pros with Medicare Supplement Plan G. The first pro is that it is comprehensive coverage. It's very cut and dry, meaning that if you take one out, you are going to pay your premium every month and then a one-time-a-year deductible, which this year in 2025 is $257. But you know, after you pay your premium each and every month, and you pay that one-time-a-year deductible, you have 100% coverage no matter what. And to put it in perspective, let's take a look at this chart here that goes over what a Plan G covers. So if you're looking at this chart here, you can look at the Plan G column, and the left side is gonna be a bunch of those exposures or responsibilities or gaps in coverage when it comes to Part A and Part B. As you can see, the Plan G covers just about all of them. It covers basic benefits. It covers the Part B coinsurance, that 20% that Part A and B doesn't cover. It covers skilled nursing facility, the Part A deductible. You can see it covers just about everything besides the Part B deductible, which is that deductible that's $257 this year in 2025. So when it comes to Medicare Supplement Plan G being comprehensive coverage, it is just that. Like I said before, you pay that premium every month, you pay that $257 deductible, and you have 100% coverage no matter what. So if you fall and break your leg, or you have a heart attack, or you get diagnosed with cancer, what the Plan G is going to do is you're going to pay that $257 deductible, and then you're not going to pay anything else for the rest of the year. Doesn't matter if you fall and break your leg. Doesn't matter if you have a heart attack or a stroke. All in the same year. It's going to cover it 100%. This kind of coverage means that you're covered in any scenario. It doesn't matter how major it is. So you can have the peace of mind going to bed at night that if anything happens to you, you're going to be covered. The second pro with Medicare Supplement Plan Gs is that there are no networks. So unlike Medicare Advantage plans, which oftentimes require you to stay inside of a doctor or a hospital network, Plan Gs are what they call non-network plans, meaning you can go to any doctor, any facility in the country that accepts Medicare, which is huge if you want to travel a lot in retirement, or you live in 2 different states, or you just want to make sure that you have no restrictions when it comes to seeing your doctor in hospitals, which also means that you are in charge of all of your healthcare choices. There are no restrictions and no referrals needed ever. The third pro is that it covers that sneaky 15% excess charge that we were talking about earlier. I see this happen time and time again, where an individual will be on a Medicare Supplement Plan N that doesn't cover that 15% excess charge, and they are responsible for paying it. And most people don't know about it. So this is definitely an added benefit that the Medicare Supplement Plan G has. And the fourth pro of Medicare Supplement Plan G is that it's just cut and dry. You're not going to have any surprise bills. You're not going to have a lot of out-of-pocket expenses. You simply pay your premium every month, and you pay the $257 deductible and you have 100% coverage. You don't have to worry about anything. Not to mention, you don't have to mess around with any denied claim headaches. You don't have to worry about any approval. It's just cut and dry. You're in charge of your healthcare. And the fifth pro is that every company offers the exact same benefits. So you really just need to look at what the overall price is, how stable the company is, and how much they lower or raise their rates each year. All Medicare Supplement Plan Gs with every company are going to be the exact same. They cannot change any of the coverages, how it covers anything, or anything it does not cover. Because Medicare decides what these Plan Gs cover, and then all these different insurance companies only get to decide how much they charge for them as a monthly premium and how much they raise or lower their rates every year. Which makes it extremely crucial that you do your research before getting on one and make sure that it's a stable company that's not a roller coaster with their rates every year and that is going to pay their claims on time. But now let's take a look at the downsides, because every plan, even Plan G, is not perfect. The first con that you're going to see with a Medicare Supplement Plan G, and you're going to find this out quickly, is that it can be extremely pricey at times. Because Plan G is such a comprehensive plan, you are going to pay a higher premium for it. And typically, depending on where you live in the United States, you're going to have a premium anywhere between $100 a month when you're turning 65 upwards to some states like New York and Florida are going to be closer to the $300 a month range. Now, where you live in the United States is going to be a big deciding factor on how much you're going to pay every single month for your Plan G, but they're also going to look at your age, they're going to look at your zip code, they're going to look at if you use tobacco or if you don't. They're going to look at a lot of different things and decide how much your monthly premium is. But like I said before, it's going to fall in the $100 to $300 range most of the time, which since that premium is set in stone every single month, you're going to pay that premium every month no matter if you use your plan or not. So if you're extremely healthy and you rarely see a doctor, you are still going to have that out-of-pocket cost whether you go to see your doctor in the year or not. But that's when you have to remember that with a Plan G, you're paying for protection. You're paying to have that on your worst health days. Now, the second con with Plan G is everything is separate. With a Medicare Supplement Plan G, you are strictly paying for the healthcare coverage. It is not going to cover anything with drugs. It is not going to cover anything with dental, vision, and hearing. You're going to have to buy all of that separately. This makes it a little difficult for the average senior to be able to afford a Medicare Supplement Plan G, because if you want all those coverages, you're going to have to pay all those premiums. The third con with Plan G is that the premiums can rise every single year. This goes back to the importance of picking a stable company that takes very low rate increases every single year and avoiding the companies that are a roller coaster. They'll drop it by 8% and then the next 3 or 4 years they'll raise it by 10% every year. Rate increases typically happen on a yearly basis and they normally follow inflation, healthcare costs, how many claims they have in a certain area for an insurance company, and other deciding factors. This is why it's crucial to review your plan each and every year with a broker that represents a bunch of different Medicare supplement carriers and that can look and price shop it for you every couple years. So to wrap this video up, is a Medicare Supplement Plan G worth it in 2025? I think it is for a lot of different people. Maybe you have a lot of different health conditions that you need to have covered, or like we talked about earlier, you plan on traveling a lot in retirement, or you live in 2 different states throughout the year, or you just don't want to mess with doctor networks. It is a perfect plan for you as long as you can afford it. But on the flip side, if you're healthy and you're on a little bit of a tighter budget and you can't afford all of those different premiums for the Plan G, the dental, vision, and hearing, the drug plan, Medicare Advantage is still a great option if you can't afford a Medicare Supplement Plan G. Now, if you do want to learn more about the Plan Gs in your specific area, feel free to call the number on the screen. I am a Medicare broker that's in about 35 different states and would be more than happy to meet with you over the phone or Zoom to go over the different Plan Gs, the Medicare Advantage plans, the drug plans, any plans that you want to discuss in your area. It's also 100% free of charge. We get paid through the carriers to help you enroll. So don't think you have to pay any type of fee. It's 100% free of charge. So if you want to utilize that, feel free and call the number on the screen and I would be more than happy to help you. Now guys, thank you so much for watching this video. I appreciate it. I hope you enjoyed it. And if you have any questions or any experiences with Medicare Supplement Plan Gs, leave them in the comment section below. That helps people that are watching this video to get an insight on your experience. Thank you so much for watching this video, and I'll see you in the next one.